It's Jennifer Shepard with the Shepard Center for Integrative Health, and it's the end of my day, so I'm a little lower energy, but I just need to share with you. And again, this is when I just have most of my ideas and thoughts when I'm driving on autopilot here, and I promise you I'm driving safe. But patients today, I had a great day of treating patients. We almost always do in the clinic, and similar and common themes that break my heart. I had a patient where part of her concerns, her troubles were our trouble with eating and digestion, some reflux, and she went to see the GI doctor, and the GI doctor said, "Oh, there's nothing wrong with you. It's just functional reflux versus like an actual, hydrochloric acid or issue with the valve." So pretty much when somebody uses the term, "Hey, you've got a functional GI disorder," or a functional things, it really they're really written off with that. Pretty much like it's in your head, or it's not truly a medical condition. It's just a functional. Which again, that's what we excel in the clinic, is let's work on these underlying pieces. So I won't go into the full details of where we went with her, but again, so frustrating for patients when they're written off that way. And again, doctors are limited with what they have in their toolbox as well, right? Most of what's in their toolbox are medications, and if there's not a medication for something, or if tests don't indicate a medication, then what else do we do with them? Or, other tests are negative, what do we do with them? Let's label them functional. But yet here the patient still has concerns and still has problems, and legit problems. And again, stuff we're working on for this particular condition are, cranium, gut-brain relationship, structural and functional, emotional, old trauma things that absolutely have affected the nerve. And we talk about nervous system communication to the organ. So there's a lot that we can do and that we are doing for this patient when the doctors didn't have anything for her. Another patient that I'm working with today, and again, a very similar theme, where the doctors are like, "Well, there's nothing wrong with you. Nothing showed up on your scans. Here's some medication." And again, frustrating for the patients. We're always grateful when, hey, nothing shows up, nothing big scary shows up in tests and scans. That's a wonderful thing. At the same time, though, they are still struggling with symptoms, and they don't want to have medication thrown at them, or maybe they've tried medication and it hasn't helped them, and so then therefore the doctors are like, "This is all I have for you." So back to how quickly one loses hope when I just have to live with this, or I just have to deal with it because the doctor says there's nothing else for me. Which again, in our work, is we work with the structural system, and we work with the function, how the nerves work. We often start with structure, and as we restore structure, then structures, organ systems can work. They can start to work those communicative pathways a little bit better. And again, it's our job. The big primary thing of our job is being detective, right? So here we have these symptoms. Who are all the players? We always look beyond. We look beyond that one structure. We look beyond that one symptom into how does the history of the person, lay a foundation perhaps for a system to tip into disease, discomfort, degeneration, right? What are other systems that perhaps are involved, and what do we need to do to restore balance in that person's system? So always often breaks my heart when I hear these stories, but again, these are the people who continue to search, and then they find us, and then as we help them understand, here's all the pieces that have come together to cause your current symptoms, and here's what we're going to do about it. Again, things don't change overnight. A lot of these things have been brewing for many years, 20, 30, 40, even 50 years. Some of these things have kind of gradually accumulated until kind of, I don't want to say the point of no return, but the straw that tips the camel's back. So at the same time though, right, how exciting that we can unburden the system. How can we help the system process, right, whatever traumas it's needed to process? How can we remove some of these